You arrive at a patient who is unresponsive, not breathing, and pulseless. What is your immediate action? A. Perform a rapid head-to-toe assessment. B. Begin high-quality CPR and attach AED. C. Wait for ALS backup. D. Check for medical alert jewelry first. Answer, B. Immediate CPR maintains blood flow to vital organs and increases survival chances. Attaching an AED promptly allows for defibrillation if indicated, which is critical in cardiac arrest. A patient presents with severe shortness of breath, wheezing, and a history of asthma. What is the most appropriate intervention? A. Administer supplemental oxygen and prepare for bronchodilator therapy. B. Start CPR. C. Place the patient supine. D. Provide oral antihistamines. Answer, A. Oxygen and bronchodilator therapy relieve bronchoconstriction and improve oxygenation. Positioning upright and monitoring vitals are essential to prevent respiratory failure. A trauma patient suddenly becomes hypotensive with a rapid, weak pulse. What is your priority? A. Administer oral fluids. B. Assess for internal bleeding and manage shock. C. Continue transport without intervention. D. Apply cold packs to extremities. Answer, B. Hypotension with a weak pulse indicates shock, often from bleeding. Rapid recognition and intervention, including controlling hemorrhage and initiating fluid resuscitation, are critical. A patient with suspected spinal injury is lying on the ground. What is your first step? A. Move the patient to a seated position to check airway. B. Stabilize the head and neck and assess airway. C. Lift the patient immediately onto the stretcher. D. Have the patient walk to the ambulance. Answer, B. Manual stabilization of the head and neck prevents further spinal damage while assessing the airway. Moving the patient prematurely risks paralysis or worsening injury. You encounter a patient with blood glucose of 32 mg per deciliter, altered mental status, and ability to swallow. What should you do first? A. Administer insulin. B. Provide oral glucose and monitor response. C. Begin CPR immediately. D. Transport without intervention. Answer, B. Rapid correction of hypoglycemia prevents seizures or brain injury. Oral glucose is safe if the patient can swallow and allows quick stabilization before transport. A patient reports chest pain radiating to the left arm and jaw, with pale, sweaty skin. What is the most critical pre-hospital intervention? A. Administer aspirin and oxygen, monitor vitals, and prepare for rapid transport. B. Give oral antacids. C. Encourage the patient to walk to the ambulance. D. Apply cold compresses. Answer, A. These are classic signs of acute myocardial infarction. Early aspirin, oxygen, and rapid transport reduce heart muscle damage and improve survival outcomes. You arrive at a patient with suspected stroke, who exhibits slurred speech and facial droop. What is your first priority? A. Assess blood glucose. B. Rapidly transport to the nearest stroke center. C. Provide oral fluids. D. Perform CPR. Answer, B. Early recognition and rapid transport to a stroke-capable hospital are critical for timely thrombolytic therapy. Delays can lead to permanent neurological deficits. A patient is in anaphylactic shock after a bee sting. Which action is most important? A. Administer epinephrine immediately. B. Give oral antihistamines. C. Begin CPR. D. Apply ice packs to sting site. Answer, A. Epinephrine is life-saving for anaphylaxis by reversing airway swelling and hypotension. Early administration is critical while preparing for rapid transport. During transport, a trauma patient shows signs of increased intracranial pressure, vomiting, irregular respirations. What should you do? A. Elevate the legs. B. Maintain head midline and elevate 30 degrees if possible. C. Lay the patient flat on one side. D. Apply rapid 4 fluids. Answer, B. Proper positioning reduces intracranial pressure while maintaining airway patency. Aggressive fluids or improper positioning can worsen cerebral edema. A patient has a sucking chest wound after a car accident. What is the immediate intervention? A. Apply a 3-sided occlusive dressing. B. Leave the wound open. C. Cover completely on all sides. D. Place the patient prone. Answer: A. A 3-sided dressing prevents air from entering the chest while allowing air to escape, reducing the risk of tension pneumothorax. You are treating a patient with severe upper airway obstruction due to a foreign body. They are conscious and coughing weakly. What is your next step? A. Perform abdominal thrusts. B. Encourage continued coughing while monitoring. C. Begin CPR immediately. D. Give oxygen only. Answer: B. If the patient is coughing effectively, encourage them to continue. Intervening too soon may worsen obstruction. Escalate to abdominal thrusts if coughing becomes ineffective. A patient presents with a seizure that just ended. What should you do first? A. Insert an airway adjunct immediately. B. Position patient on their side and monitor airway. C. Administer anti-seizure medication. D. Begin CPR. Answer: B. Postictal patients are at risk of airway obstruction and aspiration. Lateral positioning ensures safety while assessing vitals before further interventions. You arrive at a patient with suspected opioid overdose, showing slow respirations and meiosis. What is the first step? A. Begin CPR. B. Administer naloxone per protocol. C. Apply oxygen only. D. Transport immediately without intervention. Answer: B. Naloxone reverses opioid toxicity, restoring respiratory function. Oxygen and monitoring support the patient while preparing for transport. A patient presents with a penetrating abdominal injury and hypotension. What is the priority? A. Apply direct pressure and rapid transport. B. Push protruding organs back inside. C. Begin CPR on site. D. Provide oral fluids. Answer: A. Direct pressure controls bleeding while minimizing further injury. Rapid transport to trauma care is critical. Manipulating organs can worsen outcomes. A patient complains of sudden severe headache, vision changes, and weakness on one side. What is your priority? A. Assess vitals and prepare for rapid transport as suspected stroke. B. Give pain medication. C. Encourage rest on scene. D. Perform CPR. Answer: A. These are potential signs of stroke or intracranial hemorrhage. Rapid assessment and transport to an appropriate facility improve outcomes. While assessing a patient, you notice pale, cool, clammy skin, rapid pulse, and shallow respirations. What condition is likely? A. Shock. B. Hyperglycemia. C. Seizure. D. Anxiety attack. Answer: A. These signs are indicative of shock, requiring immediate intervention such as airway management, oxygen, and rapid transport. Early recognition prevents organ failure. A patient with chest trauma shows distended neck veins, hypotension, and absent breath sounds on one side. What should you suspect? A. Tension pneumothorax. B. Heart attack. C. Pulmonary edema. D. Simple bruise. Answer: A. Classic signs of tension pneumothorax require immediate decompression or rapid transport to definitive care. Delayed recognition can be fatal. A diabetic patient is unresponsive with a fruity odor on their breath. What is your first step? A. Administer oral glucose. B. Assess airway and prepare for fluids and transport. C. Perform CPR. D. Give insulin. Answer: B. Signs suggest diabetic ketoacidosis. Ensuring airway, oxygenation, and rapid transport while preparing for access is essential to prevent deterioration. You arrive at a patient who has ingested a toxic substance. they are conscious and alert. What should you do first? A. Induce vomiting immediately. B. Call poison control and follow protocol. C. Give water liberally. D. Perform CPR. Answer, B. Poison control provides immediate, evidence-based guidance. Inducing vomiting or giving fluids without instruction can worsen the condition. A patient shows signs of heat stroke, hot, dry skin, confusion, and elevated temperature. What is your priority? A. Move to a cooler environment, remove excess clothing, and begin cooling measures. B. Give oral fluids. C. Encourage exercise. D. Leave patient outside in shade. Answer, A. Rapid cooling prevents organ damage and reduces mortality. Oral fluids are secondary, active cooling and monitoring are primary interventions.